Welcome, everyone, to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban. As you all well know by now, my goal in this podcast is to inform everyone of the latest procedures, what to look for when considering a cosmetic surgery, but more importantly, to create awareness of the possible dangers. In September of last year, I interviewed one of my former patients, Joselyn, who had come to see me for a lip revision. The goal was to discuss the importance of selecting the right doctor and researching their history before doing any cosmetic surgery. Unfortunately, before we even had a chance to post her show, Joselyn passed away unexpectedly in December as a result of complications of surgery in Colombia. Out of respect to Joselyn and her family, we decided to hold off posting this episode until now. We hope that by sharing her story, we can bring honor to her life and hopefully prevent this from happening to someone else and their loved ones. Here now is Joselyn Canos' last recorded interview.
On this week's episode of Plastic Surgery Uncensored, we're going to be talking about a really interesting, fascinating, and super important topic, which is lip reductions. I'm going to be joined by a dear patient of mine, so you definitely want to tune in and learn everything there is to know about lip reductions. Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban. And on this week's episode, we're going to be talking about what I think is a super interesting and very relevant topic, which is lip reductions. Somehow or another, I slowly became a lip reduction expert. I don't know what the hell that means, but over the years, I've done more and more of these. And as I've interacted with some of the lip reduction patients, I've come to realize how common this problem is, how important this problem is, and how little information there is. And so we're really lucky and very honored to have Joselyn here with us today, and who is a patient of mine. And she has, she's courageous enough to come on today and talk because I think the subject is under discussed. And anyone who's out there who listens to this and then realizes that this is something that bothers them is going to really appreciate this conversation, because while there's so much information on breast dogs, so much information on rhinoplasty, so much information on mommy makeovers, there is hardly any good information on lip reduction. So welcome. How are you?
I'm good. Thank you for having me.
Well, we're honored to have you, and thank you for participating. So I always like to start out each episode by doing a little bit of definition. So a lip reduction is essentially a process or a surgery whereby which we reduce the size of the lips. Now, people often think that just necessarily means just for large lips. And why would anybody want to get a lip reduction? So there are different people and different reasons. One, of course, is just being born congenitally with very large lips. And that seems like a crazy concept. Like today, everyone is trying to make their lips larger. I mean, why on earth would you ever make your lips smaller? But some people, and of different ethnicities, have very large lips. And just like you want to make your nose smaller or your breasts larger, it isn't unreasonable in some instances to want to make them smaller. So that's one subset. But I would say the overwhelming majority of other subsets are individuals who have had injections in their lips of substances that are permanent and that have now created irregularities and lumps and bumps and enlargements of the lips, hence creating an unattractive shape and size, who want to improve the contour of their lips as well as the size. And the last category is people who've been in trauma, dog bites, car accidents that have healed sort of undesirably and created a contour. The lips are really unique anatomy. They're highly coveted. Right? Lips are beautiful. We accentuate them. They're functional. We use lips to eat and drink and kiss. And they're very visible in your face. So even the slightest irregularities are visible and create sense of insecurities and also change in the way they look. So it's a very interesting topic. There isn't a lot out there on it. So let's start out with Joselyn. Tell me what your story is and what brought you to me and how you got where you got.
Oh my God. So it all started a long time ago when I got filler injected, right? So they gave me like two options. One was if I wanted it like Restylane, I think 6 months, or they said something that lasted 2 years. And I was like, well, I could just spend a little more and, it's going to last me 2 years. So I don't have to keep doing this so often. So then I had something called like Artifil, I think. I don't remember.
Artifil, right.
I remember the name Artifil. Or
Yeah, it's Artifil is correct. It's a drug. It's a filler that is arguably permanent, or they say semi-permanent, but you're absolutely correct.
So then when I got it done, like it looked good and I was happy with it. But as the years went on, like I started hearing comments from people like, stop injecting your lips. Like, okay, that's enough. And I was like, I haven't touched them since then. And I didn't see it myself, because you see yourself every day in the mirror. Like you don't really notice these gradual changes as they go on throughout the years. So I just kept hearing that, from people like about lip injections and me. And I was just like, are my lips really that big? And I just kind of like, one time I was like skimming through old pictures, I think on Facebook or something. And then I was like, whoa, my lips have grown like drastically since then. Like how did this happen? I was just so confused. And then, I started reading up on the material that was injected, and I guess it just started producing, like my own tissue was like expanding somehow. And there was like little lumps everywhere, and then that's like I was like, okay, this is enough. Like I'm tired of hearing this. I just felt like my lips were just so massive that they took over, like a big portion of my face, and it just didn't look good anymore. So then I actually looked into getting like a lip reduction. And
so I'm going to stop you right there because I want to take this in phases, because that's a very important subject. So what you discussed is indeed the overwhelming majority of patients that I see, right? So there are, again, 3 categories. I was naturally born with large lips. I had trauma and, damaged my lips. And I had something injected in my lips, and now I'm unhappy with the shape. The overwhelming majority of patients, and I see international patients for this, I'm talking Dubai, Brazil, everywhere, are women and men who have had some substance injected in their lips, most of the times unknowingly, advertised as the, holy grail to lip injections. Like they're always presented to patients the way you were presented. Like you can inject X and you have to keep doing it and it's blah, blah, blah. Or you can inject Y, dun, 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 and you never have to inject again. It's permanent. It's long lasting. It's amazing. Well, obviously, when presented with 2 options, I'm always going to pick the one that's potentially permanent or lasts a long time. And what happens, and the substances are endless, but Artifil, which you had injected, is quite common. The number 1 most common injected material is silicone, liquid silicone. And it happens in professional offices all the way down to parties at home. A lot of these patients have these injected by non-real practitioners, or we'll get into who injected you, but usually they're quasi-injectors, nurse injectors or whatever. And they get them injected, and almost all of them say they look beautiful. And almost all of them are super excited with them initially. And what happens across the board is exactly what you described, which is over the course of years, they start to morph, change, expand, become irregular, lumpy. And what's happening is exactly what you described. So you did a lot of good homework, and you're right. Your body recognizes this material as foreign, like a pacemaker, a prosthetic knee, a breast implant. It doesn't matter what it is. Your body knows the difference between live and not live. And unlike a breast implant, which is a solid one piece, this is millions of particles. And your body's like, uh-oh, this is not good. And it starts to then try to get rid of it and create little tiny microscopic granulomas or little scar balls around each of these. And your body is trying to get rid of all these millions of droplets of this product. And when it starts to do that, it does exactly what you described. It gets inflamed, swollen, and there's inflammatory growth that creates the increasing size. So almost all the patients I take care of say, my lips never look like this. They were really tastefully done, and over the years, they've grown and they've become lumpy and they become irregular. and they change with hormones and when I got pregnant and when I have my period and certain nights when I go out and have a drink or whatever. And so then they get to a point, and exactly like you said, they're subtle. It doesn't just happen overnight. You don't just wake up one morning. It's like little by little. And then usually it's exactly that. Someone says, like, it's usually someone that really cares about you. And they're like, your lips are looking crazy. And you're like, what do you mean? I haven't done anything. And sure enough, that's where you get. So wonderful description, right on the money. So then you like, I got it. I can't hear another person tell me this. So then what do you try to do?
So then I just started doing research online, and I was like, okay, how to dissolve lip filler. And I tried that and it didn't work. So then I was like, okay, this is permanent, And then I started looking into lip reductions. Actually, no. Before that, I actually was getting 5FU and what was it called?
Kenalog.
Kenalog, yes. I was getting those injections. And
so stop right there for a second, because I'm going to keep you're right. So commonly you get injections, right? You get Juvederm, Restylane, whatever, and you're like, oh my God, this person went nuts. This looks crazy. So you go and you reverse it.
Yeah.
Right? My cheeks look crazy. Reverse it. Yeah. That's the beauty of the reversible type products. Yes, in exchange, they go away, but if you hate it or it looks terrible, you can reverse it. So you went and tried to reverse it, as have thousands of women, only to find out, well, shit, this stuff doesn't go away because it is not that product. Then you shifted gears to these 5FU and Kenalog. What are those things? Those are anti-inflammatory injections. Those are things you inject to try to reduce the inflammation. And that's what surgeons try to do to kind of quiet down your body's reaction. But they have a lot of downsides because it's kind of like, it doesn't know the difference between good and bad. So you did a few of those. Where did you go to get these injections? Where are you going in this part?
In Orange County, like Newport, somewhere in Newport Beach.
Right.
And it somewhat helped, but not to the effect that I needed them to help, So then I was like, okay, I started looking into lip reductions, and I just remember, like, I was like, oh my God, like, can't believe I have to do this, as a surgery to remove this stuff. And it was really hard to find information on, anything lip reduction related. And I found someone in LA. And
where do you live?
So at the time I lived in Orange County.
Okay.
Yeah.
Okay. So you highlighted the problem, and that's why we're so grateful that you're here and why we're having this conversation. And we'll have more of these conversations. Like, so you want to get a breast aug. So you go online and you Google it, and there's like 8 million pages. But you go and say, God, I got this crap in my lip. It's not what I had anticipated. I need to fix it. How do I get it out? And you're just like, crickets. And then the information is really shitty. Yeah. So what did you find? What was it that you kept running into?
So basically it was people that were born with, natural big lips, and my situation was different, obviously, because they had, to basically dissect the lips and try to remove, that foreign material and shape them at the same time. So I just felt like my case was a lot more complicated. I couldn't really find any information or before and afters or anything like similar to my case, So I did find like this one surgeon who I was like, okay, he has some, and it was similar. He had some cases like mine. So then I went to him, and then I got it done, and it was definitely like an improvement, big time. It was a lot better, but the lips, like, they didn't have shape to them, it was just kind of like that had ruined my lips, like whatever it is that I injected in them. So they were uneven. So one side was like bigger than the other side. It wasn't like an even lip reduction. And then, I just kind of left it like that for whatever. I was, this is better than what I had before. So I'm just going to deal with this. And then as time went on, I was like trying to, like do a little shaping here, a little here, So I was like, okay, I try to even the lip out a little more. So then they did like a little incision, and then that really helped. So it was a lot more even. And then I wanted on another occasion to just make this a little bit smaller, my top lip, the bottom. And that's where it went downhill. So I went.
Hold on to that. Hold on to that. That's the perfect, went downhill is a perfect segue to our break. And then we'll come back to the second half, because we always have to have a hook to get people to come back on the second half. So hold your thought, because we're going to get into what is a lip reduction? How is it done? Did it hurt? What's the aftermath, et cetera, et cetera. So perfect. So you got to tune in to hear what happened on the second half of Plastic Surgery Uncensored. Don't you go anywhere. Welcome back to the second half of Plastic Surgery Uncensored. We are on a very, very exciting and very interesting topic here, which is lip reductions. Joselyn was about to tell us how things went downhill. So you had injections in your lips. They caused you all kinds of problems. You started having incremental lip reductions, and you started to realize, as most people do, lip reductions are super difficult, very challenging, because you have two objectives. The objectives are, number one, the objective is reduce the size of your lips. That's the easy part. The second part is create a beautiful, symmetrical, attractive contour. And so that's where you're going to run into the challenge. So you did two, got better, and then you went for that tiny little touch to create more evenness because it was irregular. And then what happened?
So then I have a surgeon that he's operated on me before, and he's really good, but he had to leave out of town. And I just was like really impatient. And I don't know why, now I regret it, but whatever. At least now it's getting fixed. Oh, it got fixed. But so then I was like, you know what? Like, it's such an insignificant surgery. Like, it's so small, like minuscule. You just do a little cut. Like, anybody can do this. Yeah, no. That was just dumb. So then I found some surgeon here, in Mexico. And I read some reviews, and apparently she was good. No. Oh my God. I just remember, like, it was really painful. And then after this was like a $150 procedure, like, and I didn't go there for like the price, obviously. I just felt like it was like, if a surgeon can go in and do breast implants and lipo and all this crazy stuff, how could they not just do a little incision, cut a little piece and sew? Like, to me, that's how I felt. I was like,
right, which is how many people feel, right? You're not any different than the average person you're not the only person who has walked down this particular plank. So it totally makes sense.
Honestly, anything with your face, like, she did it. Like, it wasn't even straight across. Like, she like did it, like she chopped off half of it and then left the other one. It was just horrible, like, just bad.
Right.
I was just really, really depressed. I was like, wow, I can't believe I did this to myself. Like, I don't even know if I can get this fixed, because it was just not much to work with now at that point, because she had taken so much off of it. And I just really felt helpless. So then, I started like inquiring and doing research online. And I was like, okay, I can't just go to anybody. Like, I have to go to somebody that I truly feel is like, that I'm going to be in great hands, and that has dealt with this often, like very often, that, I'm going to be in good hands. I'm not going to be a guinea pig. So I was just looking like all over, like lip reduction experts, and, and then I stumbled upon you, and then, you were very like realistic with me, and I'm just really glad that I ended up like trusting you and going with you.
So I think you have eloquently displayed some of the things that we want people to understand. Number one is stay the hell away from anything permanent. Just stay away from it. Any injection in your face that's permanent is going to end up having issues. So, unfortunately, most of the people who get injected permanent things often get them injected in kind of like not so great places, spas, nurses, injecting here at the house, my friend, this, that, the other. Not always, but often. Secondly, when it comes to doing things, I'm not to suggest going to Mexico or Costa Rica or England or wherever is not a good idea. That's not relevant. What's relevant is make sure that whatever you're getting done, that person is an expert in. And I think the problem with lip reductions is there's just not a lot of people. I mean, you do hundreds and hundreds of doctors do breast augs and facelifts. But when it comes to lip reductions, and why we're really having this conversation, is it's kind of uncharted territories. And as I described to you, for many years, I didn't even have lip reductions on my website. And why was that? Because it's a really difficult procedure with very little margin for error. And in exchange, it's a time-consuming, non-profitable procedure. And so for many years, I didn't want to advertise that. I sort of slowly became this guy that did these. But then after having met so many patients like you, for whom this lip irregularity was devastating, and people who are like, well, it's just a lip. No. If you have an irregularity in your lip, it can destroy your life, because every time you talk to someone, every time you kiss someone, every time you smile, every photo you take, it's right there. So I started advertising them, meaning educating people and putting them up and so on and so forth. And here we are now trying to get the information out. What I want people to understand is what a lip reduction essentially is. Once you have something injected in your face, body, buttock, whatever, liquid that's permanent, it can never be removed. Never. It can't be cut out. It can't be removed. It's dispersed throughout all the tissue. So what we do is we're actually cutting out your normal tissue along with whatever amount of silicone or artifill that's in it. So we're just sculpting your own tissue with the stuff still left behind. We have patients who call from all around the world with silicone injected in their buttock, and there's nothing I can do to take it out, and they get infected and all kinds of things. So what we're doing is we're taking out a sliver of your own tissue along with that to create a new contour. Remember, there are two things, right? Reducing the size of your lip, and more importantly, creating a beautiful shape. And your issue after the first reduction was all shape related. It wasn't that my lips were huge, right?
Yeah.
It was about, it's irregular, it's asymmetric, it's weird, it's lumpy, it's and so on and so forth. So I think that, lip reductions are I guarantee you that people will send in a bunch of questions, because I think it affects more people than are willing to admit. There's a little bit of a shame associated with having had something injected in your lips that you didn't know what it was, kind of almost feeling like, God, shit, I did this to myself.
Yes.
And then you go online and there's very little to no information, and you kind of feel helpless. And so this is really big of you to come on and have this conversation, because through you and me, we get a little more information out, and then a little more information. And then people become knowledgeable. And what we're trying to do is get people to not need a lip reduction. But if you do need it, now you know the information. So I really appreciate you coming out and sharing your thoughts. Any last minute advice that you have for anybody who may be in your situation?
Just do not, trust just anybody with your face. Like, do a lot of research about who you're going to let touch your face, because they could either make you look better or make you look much worse. So
I think those are all very sound information. And like everything else, you just want to do some homework. And hopefully this podcast episode will add to your knowledge. At any rate, thank you for joining us. That wraps up another episode of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban. Make sure to tune in next week, as I'm sure whatever topic we're talking about, it's going to be interesting.
Here you have it, the last interview with Joselyn Canos. It was a true honor to have her as my patient, as well as a guest on our show. It's so sad that a young and beautiful woman like Joselyn had to die before she had even begun to live her life to the fullest potential. As I mentioned at the start, we decided to continue with this episode as an homage to her, and to hopefully bring a heightened awareness of the dangers that it can occur as a result of plastic surgery or any medical procedure. We hope you can join us in the next episode of Plastic Surgery Uncensored. Be safe.